A number of our wine industry forums have provided information regarding the new Oregon-OSHA temporary rule regarding COVID-19 workplace risks. This morning, we'd like to provide a brief overview of the requirements in that rule with regard to the wine industry. This presentation was developed with the support of the Willamette Valley Wineries Association, the Oregon Wine Growers Association, the Oregon Wine Council, the Oregon Wine Board, and the Southern Oregon Winery Association. This overview is not intended to replace legal advice. For specific guidance and resources, please review the Oregon-OSHA website. Just Google Oregon-OSHA COVID-19 Workplace Risk Rule. This slide provides an overview of the general provisions of the temporary rule. It became effective November 16th and will remain in effect until May 4th, 2021, unless it's revised or repealed. Most of our tasting rooms and wineries are following the majority of the guidelines associated with this rule. For example, we all have become familiar with the symptoms of COVID-19 and how it's transmitted. The rule requires that we need to minimize the transmission of COVID-19 with the primary safeguards of good personal hygiene, hand hygiene and respiratory hygiene, physical distancing, source control of the virus with proper face coverings, masks, face shields, the requirements of regular cleaning and sanitization we are all familiar with by now. The rule does introduce 3 tasks that we need to complete by year end. The first is to complete exposure risk assessment. The second is to complete an infection control plan. And the third is to complete employee training. Just in the last few days, we've got an extension from Oregon-OSHA on when we need to complete these tasks. They do need to be completed by December 28th of 2020. The temporary rule on workplace risks is about a 100-page document. The Oregon Wine Industry Task Force has condensed the key 9 pages of the rule, and that condensed version is available through your various wine grower associations. It contains hyperlinks to a lot of other resources that you can refer to. Section 1 of the rule states that the rule applies to all employees in places subject to Oregon-OSHA jurisdiction. Therefore, employers that have such employees need to follow the provisions of the rule. Section 2 provides definitions of key terms. We will not discuss those key terms today, but they are available in that condensed version I referenced. Section 3 is the focus of today's presentation. It's applicable to all workplaces, and in particular our wineries, tasting rooms, and vineyards. Section 4 is requirements for exceptional risk workplaces, for example, healthcare facilities, and does not really apply to our wineries and tasting rooms. The one appendix that applies to our businesses is Appendix A1. It does provide guidance for tasting rooms and wineries. However, the general provisions we will be discussing today covers the Appendix A1. I'm now going to jump right into Section 3. Subsection A deals with physical distancing. We're all familiar with these requirements. We need to eliminate the need for employees to be within 6 foot of one another unless it's not feasible for certain activities, for example, pouring wine for our customers. In that case, it needs to be a limited amount of time. Subsection B covers face coverings, masks, face shields. Employers must ensure that all individuals at the workplace wear face coverings according to Oregon Health Authority's guidance. The Oregon Health Authority has just recently updated their guidance on face coverings. They highly recommend masks, and that new update is available as a hyperlink in the document I've referenced earlier. Employers must provide the masks or face coverings at no cost to employees. And when employees are transported, for example, vineyard workers, all occupants must wear face coverings. Cleaning and sanitization requirements, again, we are familiar with. Employers must clean and sanitize all common areas, shared equipment, and high-touch surfaces, and provide the supplies to do that. This needs to be done at least once every 24 hours in most of our workplaces that are occupied less than 12 hours a day. It needs to be done every 8 hours if a business is open 12 hours, more than 12 hours a day. And any areas or equipment that have been touched or around persons that have tested positive for COVID-19 need to immediately be cleaned and disinfected. Subsection D of the rule requires us to post a COVID-19 hazard poster, a specific poster that is provided by Oregon-OSHA. It must be posted in a conspicuous manner and provided electronically to remote employees. I'll show a picture of that poster in a second. Subsection E, all building operators, employers that operate or otherwise control a building, must take the following steps. They must ensure that the sanitization requirements that I just mentioned are met, and that face coverings requirement sign are posted also in conspicuous places. Subsection F are ventilation requirements. No later than January 6th of 2021, employers must optimize the amount of outside air that is circulated through its HVAC systems. This does not require the installation of new ventilation equipment. However, if you turn on your exhaust fans in your bathroom or your kitchens or any other exhaust fan you have in the building and crack a window, that does enhance the inclusion of outside air in the building. We also must ensure that all air filters are maintained and that the intake ports that provide outside air into an HVAC system are cleaned and maintained. This slide provides a picture of the poster that OSHA requires we post in conspicuous areas of our workplace. It is an overview of the standards for all workplaces. This slide is a picture of the poster that's preferred by Oregon-OSHA with regard to the requirements for wearing masks, face coverings, and face shields. The workplace risk rule requires that all employers complete an exposure risk assessment. This must be completed before December 28th, 2020. And as you conduct the assessment, you should think about the risks to the employees without regard to whether they're wearing PPE or face coverings. The risk assessment must involve participation and feedback from employees. We recommend that you get your managers or supervisors or maybe all employees together as you complete the risk assessment questionnaire. Employers with greater than 10 employees must record the risk assessment in writing. The assessment must include information on the person who performed the risk assessment, the date it was completed, the various employee job classifications that were evaluated, and a summary of the employer's answers to the exposure risk assessment questions. Oregon-OSHA does provide an exposure risk assessment form that includes all of the required questions. The Oregon Exposure Risk Assessment Form is a 4-page document that includes all the key questions that you need to answer as you develop your workplace exposure risk assessment. After completing the exposure risk assessment, every employer must then develop an infection control plan. This needs to be developed prior to December 28th, 2020. The employer must establish and implement an infection control plan based on the risks identified in the exposure risk assessment. The plan should implement appropriate controls that provide layered protection from COVID-19 hazards that minimize reliance on individual employee training and behavior for their efficacy. Layered protections include, for example, having the ventilation system introducing fresh air, or at least keeping a few windows open with a crack so fresh air is entering the building, having employees and customers wearing face coverings, sanitization practices that are done on a regular basis. Employers may rely on materials developed by industry associations and licensing agencies to assist with compliance. We need to provide that mechanisms for employee feedback are provided in the infection control plan development. Again, employers with greater than 10 employees must document their infection control plan. Oregon-OSHA provides an example of the key items that need to be addressed in the infection control plan. This slide just provides a picture of the document that Oregon-OSHA provides to assist in developing your infection control plan. It's a 2-page document, and if you fill out the various sections of this document, you'll have covered the key aspects of an infection control plan. After completing the exposure risk assessment and the infection control plan, the rule requires that all employers provide employee information and training. This needs to be done by December 28th of this year. The training needs to be done in person, remotely, or with computer-based models. Training must provide employees the opportunity for feedback and discussion. There are 10 key aspects that need to be included in the training. Physical distancing requirements, the face covering requirements, COVID-19 sanitization procedures, the signs, symptoms, and reporting procedures in the workplace for COVID-19, the infection notification process if an employee tests positive, medical removal or isolation quarantine requirements if an employee tests positive, the characteristics and methods of transmission of COVID-19, the symptoms of COVID-19, information regarding the ability for asymptomatic or pre-symptomatic persons to transmit the disease, and the safety and health work practices within the workplace. On the Oregon-OSHA website that I referenced earlier, there are links to training modules that cover 4 of the key aspects of the training that is required. It provides general information, the COVID-19 hazards, the signs and symptoms of COVID-19, and general safe work practices. We suggest that you utilize this resource in developing your training for your employees. The resource is available via a YouTube video or a PowerPoint document. This slide provides an overview of a few other requirements of the rule. Subsection J requires the employers establish a process to notify both exposed employees, employees that have had close contact with COVID-19, and affected employees, employees that have worked in the same facility where there has been an employee that tested positive for COVID-19. This notification needs to be done within 24 hours if there has been a work-related positive case of COVID-19. Subsection K requires that employees must cooperate with COVID-19 diagnostic testing at their workplace, initiated by either the Oregon Health Authority or the local public health authority. Subsection L requires that positive COVID-19 workers must isolate outside the workplace. Employees should be allowed to work from home if suitable work is available, and employees are entitled to return to their previous job without adverse actions. Decisions regarding testing and returning to work must be in accordance with acceptable public health guidance and the employer's medical provider. Subsection M requires that you follow the appropriate guidelines in the appendices. In the case of tasting rooms and wineries, that's Appendix A1, and we provide an overview of that appendix in the consolidated or the condensed version of the temporary rule that I referenced earlier. However, the guidelines that I've just provided in this overview generally are those that are required in Appendix A1. That completes a summary of the key requirements of the Oregon-OSHA COVID-19 Workplace Risk Temporary Rule. Just as a checklist, we all need to ensure good personal hygiene in the workplace. We must enforce physical distancing. We need to ensure source control of the virus by requiring masks, face coverings, and face shields in the workplace. We need to ensure regular cleaning and sanitization. We must post the two signs, both the COVID-19 hazard poster and the mask required poster. We must complete a review of our building ventilation systems, complete the exposure risk assessment, implement an infection control plan, and complete the employee training, all by December 28th. And we must implement policies for employee notification, testing, and isolation with regard to positive cases of COVID-19. As a last comment, I would just state that Oregon-OSHA does have a consultative section that you can access via their website. The contact information is available on their website. If you have specific questions or unique concerns, we invite you to call that section of Oregon-OSHA. It's a no-cost, confidential service. Thank you very much for your attention to this presentation and for complying with this new Oregon-OSHA rule.